All right. Hi and good afternoon, everyone. Thank you for joining the March Restoring Neighborhoods webinar. My name is Nathan Park. I'm a Policy and Research Associate here at the National Housing Conference, and I'm looking forward to today's presentation with all of you. Before we jump into things, I want to highlight NHC's upcoming event, Solutions for Housing Communications, the only national convening designed for housing communicators. Sessions will feature national experts and engaging topics on media relations and digital communication strategies that will help organizations rethink how they communicate with policymakers, media, stakeholders, and constituents. This year's convening will be held on April 16th at the National Press Club here in Washington, D.C. And you can register now at the link that's listed on this slide and can be found on our website. Regarding other NHC updates, at the end of this webinar, our Policy Director, Tristan Bro, will provide further updates on what's happening here at NHC. Today, we are very excited to have Frank Relihan, the Senior Vice President at Northmark Capital, here to discuss the Conway Center, an innovative mixed-use project here in DC. We at NHC are really amazed with the development and its impact and believe everyone tuning in will think so too. And before I turn it over to Frank, I have one technical note. So today's presentation is being recorded. You will get a link to watch the recording afterwards, as well as access to the slides. If anyone has any questions about Frank's presentation, please use the chat box on the right-hand side of your screen to ask them. We will get to as many questions as we can after the presentation and really encourage you to ask them so that we can engage in a bit of a discussion. Finally, if you're having technical difficulties, please use the help menu or visit the website listed for assistance. And with that, I'll turn it over to you, Frank.
Thanks, Nathan. Hello, everybody. I wanted to, is the screen up? This is all new to me, so I apologize. Okay. So my name is Frank Relihan. I want to talk about the Conway Center, which is a project that I've been working on since 2011, 2012. I'll tell you a little about myself. I'm in the commercial real estate business. I've been doing it for over 30 years, based in DC. I've worked for institutional investors, foreign and domestic. The last 20 years, I've been working exclusively on apartment financing. In 1999, I got involved with Fannie Mae, Freddie Mac, and FHA, working for a lender here in DC. As everybody knows, in DC, where Fannie and Freddie is based, we constantly are tripping over each other. So I actually work on deals that are a little different and unique. And over the 30-some years, I've probably closed close to $4 billion. Tell you a little about Northmark. Northmark is a national commercial mortgage banking firm based out of Minnesota, owned by the Pohlad family. The Pohlad family also is an owner of the Minnesota Twins. They own River Rock Entertainment, which did 12 Years a Slave. They're the largest single investor personally in the in U.S. Bank. We have roughly 500 employees in 37 offices around the country, doing all product types. In 2018, we closed $13 billion of production. Our servicing portfolio is roughly $56 billion across the United States of all product types. And just to give you an overview of what we did last year, 52% of our business was multifamily. Obviously, that's a big component of our business, being a Fannie Mae, Freddie Mac, and FHA lender. We dabble in all product types, actually do a lot of hotels. We also do equity placements. So that 10% of other is the equity stuff. So let me tell you about Conway and my background and my relationship with this project. I have been a long-term volunteer of So Others Might Eat. So Others Might Eat is an organization that was formed in 1970. After the riots in the late 60s and early 70s, there was a gentleman by the name of Horace McKenna who was a Jesuit priest that was like 5 blocks from the Capitol, who had a fair amount of homeless people coming to him, and he decided to create a whole holistic approach to homeless, and basically started as a soup kitchen, if you will. Um, they are not a housing first model, unlike most of the competitors that I've seen in the marketplace. And that's why this project, I think, got done because of that, because of the uniqueness of how this works. Some feeds over 1,000 people 2 meals a day, 365 days a year. And I got involved with it back in the early 90s when I personally was volunteering there with my children at the time, and obviously has grown to where it is today. In 2018, some had fed over 480,000 meals, and that includes the resident service component, which is I'm going to talk about in a few minutes. They had over 11,000 volunteers in DC. People from all over the country and all over the world have come to some to serve in their dining room. That's where it starts. Across the street from their headquarters on O Street Northwest, they have their headquarters in a medical and dental facility, so the homeless can come in and be taken care of through their Medicaid and whatnot. Their housing initiative started in 2010 of having 1,000 units, and they're currently at 800 units in the District of Columbia alone. So they don't go outside of the District of Columbia. They're very focused and very unique. This is basically a 5-minute blurb on some, and so Nathan, if you don't mind, you could take over and run this.
All right, and just for everyone tuning in, so the sound is going to come out of your desktop, not through the phone line, just so you're aware.
Okay. Um, so that's just an overview of who Some is. And that film was produced back in 2014. And I want to talk a little bit now about the poverty in DC, which is why Some is the largest organization that provides a holistic approach in this town. Um, Based on DC's 700,000 residents, 17% of them are below the poverty level. It's basically a town of two different worlds. I've lived in this town now since 1985, and I've noticed a big change. A lot of money is coming in here. Uh, Administrations change, but the poverty level has gotten worse and worse over the last 10 years. 9% of the DC residents are below 50% of the poverty level. That's a big number. Now, granted, it's not like some other locations or states that have a bigger issue and lots more uh, issues with homelessness, but DC has changed, and I've witnessed it over the last several years. 41,000 households in DC are on official waiting lists for housing assistance in some form or fashion. Granted, that might be stale, but that's the numbers that I've seen. 2018 DC homelessness count under Pitt was 6,900 people, which include almost 2,000 children. Now that number has come down in 2018. And 2019 numbers, I haven't seen them yet, but maybe somebody else can talk about that. But that number, when I first started working on the Conway project in 2011, was like 3,000, 4,000 homeless. It peaked in 2017 at like 8,000 homeless. And I've noticed that with Conway and other projects that the District of Columbia has been doing is really taking this issue at hand. About 20% of the population does not have enough money for food or for themselves or family. And I'll be honest with you, I do volunteer at the kitchen still probably twice, 3 times a month, and it's the same people. It's also the Conway project is also located in the poorest ward in the district, which is Ward 7. It's also the least educated ward in DC. And as you can see by the pictures, it does have a lot of good press with presidents. And I will say that even though the current president has not been there, the vice president and the HUD director has been there. And it goes across all administrations. There's a large support for this organization and poverty in DC. Let me tell you a little about the Conway Center in the overview. Conway Center is named after Bill Conway and Joanne Conway, which if you don't know who Bill Conway is, you probably should. He is one of the founding members of the Carlyle Group. He's one of 3 partners, the senior partners. Everybody might know who David Rubenstein is. He has donated millions of dollars to preserve the Lincoln Memorial, the Kennedy Center in this town. He bought the Magna Carta and gave it to the Smithsonian. He is a big benefactor. Bill has focused on giving away his money towards 2 things: homelessness, job training, and preserving people to get an education. So he was the visionary behind Conway Center when I first got involved with this project in 2011, 2012. It's a 320,000 square foot mixed use facility. It cost $90 million to build. When I first started working on the project, it was $70 million to build, but with construction costs going up, it went up dramatically. It has 202 affordable units at 30% of AMIs. They're SROs and efficiencies. There are 2 towers. If you notice in the picture on the right, you'll see on the right-hand side there, the 1 tower on the project is basically the single adult, and then on the left-hand side up above is a housing for 30 families, and there's 156 units for single adults. Even though it's 202 affordable units, there are roughly 20 units for the staff and supportive services that Some offers. One of the big benefactors of this project, of the mixed use and the complication of it, it is a condominium regime. There is on the first floor and the second floor, on the first floor, there's a healthcare facility that's going to be opening up in the next month or 2. It's going to be a health clinic run by Howard University Hospital and Unity Healthcare, which is the largest provider of health Medicaid and Medicare benefits to DC. Um, the the second and third floors are basically the Center for Employment Training, which is as you saw from that previous video, is some has a holistic approach. They take people off the street, they get them sober, they get them on their medication if they have mental illness, they get them in a highly supportive services, and then they get them training. And I'll go through CET in a minute, which is one of the most interesting things about this project in my mind. The great thing about this asset, it's right across the street from the Benning Road Metro, and the Benning Road Metro connects to the whole subway system and transit oriented, and that's one of the reasons why HUD got involved with this deal from the very beginning, because of all the obstacles involved. The next thing is, Nathan, before you run this, I just want to tell you, this is the groundbreaking presentation for them raising money, and you'll see people on this video, including the folks that worked with me on this project, including the tax credit investors, Bill Conway, and Father John, who's the CEO of the organization. So go ahead and run that. I just want to give you a sideline that the the groundbreaking was, I think, in July of 2015, which is when that video was shot, and that was a 95-degree weather and 90% humidity, and you would never see that by looking at that, but everybody was hot that day. It had a lot of support, a lot of people show up for it, and got a lot of local press. I want to talk a little about the CET project because that's part of something that SUM is working on and continuing to work on that they've been doing for several years. It is an accredited post-secondary education facility. It has 21,000 square feet on the second floor. It focuses mainly on building trades and nursing. It doesn't do anything else beyond that. A lot of the people that come in here don't have education. Some of them don't even have GEDs. They get them their GEDs. They get them into a trade, into a program that worked. And to be honest with you, I don't know the number of counts, but I know the people that graduated from this program did work on the construction of this project, just as an FYI. I know that SUM has tracked their people. There's an 85% retention rate for people that are posted in jobs that they find through the building trades or the nursing focus. It's all private paid and government assisted. They started out as 100 graduates a year. With this new facility, they're going to be able to have 300 graduates per year. And the one thing when I did do the tour of the property after it was completed and got some of the information from the CET people is that the average cost per grad is $7,000, which is cheaper than what some of the post-secondary colleges and community colleges are charging. And to be honest with you, I just heard in the DC public school system, I think the budget's now up to $20,000 per person. So this nonprofit knows what they're doing. They know how to take care of the issues, and they've been resolving it. Let's talk a little about the overall project. It was a true public-private partnership. It included tax-exempt bonds. It includes housing production trust funds from the District of Columbia, which I'll talk about in a second, LIHTC money, new market tax credits. And out of the $20 million that was given to or donated to SUM, I know Bill Conway was the largest portion of it. I think he gave like 8 or 9 million of the 20 million, and the rest was basically donated through over 1,000 private donations. One thing SUM does have is an extensive network of, and they have over, I think it's like 80,000 people on their mailing list. So it has a large focus there. I did the HUD portion of the loan, and that was a very complicated loan because of all the issues that were resolved with it. There's a new 40-year LORA at 30% of AMI of this project. One thing I will tell you, and you can look at the sources and uses, I think there were over 7 funding sources that we got on this project. We provided basically the only mortgage that's recorded against this asset, which is $8.3 million, and that matches obviously the vouchers that they get for the housing choice vouchers. DCHD basically has a housing production trust fund that was established in 1990. It is basically a revenue that they generate through basically deed recordations and transfer taxes, as well as through the district's general fund. The current mayor has committed over $100 million annually to fund this project, or not this project, but this initiative. And that was a big source of money that came into this project. We had LIHTC money that was given through City. City actually did the LIHTC loan of $20 million against that. And that's just on the housing side, and that's 51 million of the $90 million project. The commercial sources, as you see, a Healthy Future Fund loan came from Kresge Foundation that was traded above par. Some basically gave gap loans. There was new market tax credit equity, and that basically covered CET and the Unity Healthcare, which is roughly $39 million. There were several challenges on this project from the very beginning, and when the deal was finally completed in 2015, obviously the construction side of it and getting everything, all the documents, we had over 300 unique legal documents. We get on weekly or monthly conference calls starting in 2012, 2013, and I had roughly 30, 40 people on these conference calls, and I'm sure people in this call have been on those before. I really haven't in the past, so it's kind of interesting to me. At the time that this loan was brought to HUD, they had a moratorium on single room occupancy SROs. We're not going to do any more SROs. And back in the crisis of '08 and '09, they had a lot of projects that go south on them. So they basically said, no, we're not going to do it. We actually got from the national office a waiver to do the SROs, and that really helped a lot in this process moving forward. Also, back in 2011, 2012, if you recall, after the Great Recession, the only lender of doing construction loans in the District of Columbia, and mainly the United States, was HUD on apartments. So they had a moratorium that they put on like 2 months before I brought this deal to them. They're like, we're not going to look at any deals in DC. But when they saw this project and uniqueness of it, they basically granted that moratorium. They removed it for this project. There was this is a condo regime, so there are separate owners for separate parcels and separate floors. During the construction loan, District of Columbia is a little unique, and I don't know if your areas are the same, but the condominium regime is something you get air rights during the construction. So that was a complicated structure that we had to deal with. It was also a vertical condominium structure. HUD actually has an issue with doing loans on projects where they don't have a piece of the dirt, where they're above everybody else. And they've only done it once or twice before this project came along. And that was a challenge and very complicated. There was several reciprocal use agreements involved and very complicated languages that we had to deal with, just so you know. This project actually won a fair amount of awards in the last year. I actually met the people at the National Housing Conference at the ULI for the Jack Kemp Award that was awarded last year for excellence in affordable housing. The Real Estate Forum, which is a industry real estate brag, gave it one of their top deals for 2018. That will be announced next month. And then Hand gave them the Developer of the Year last year. So this project was a very interesting project I worked on. It's more of a labor of love for me because I love the organization. I love what they do. I've witnessed how they are highly supportive and fell into real estate from a social services side. And if they can do it, anybody could do it. So that's my presentation, and I'll be more than happy to take any questions if you have any.
Great. Thank you, Frank. That was really fascinating. And we do have a number of questions. And so anyone else also tuning in, please feel free to add yours into the mix in the taskbar on the side. This first question reads, can you elaborate on how Housing First might have made the project more difficult to complete?
I don't necessarily know if Housing First would have made it more difficult because I think they would have been a little more experts related to this project. My experience is that you need the supportive services at this level of housing. There are people that I've seen where that are highly supportive and they've gone through their drug addiction or their mental illness. They've been back on, and they're contributing to society, but they don't want to leave the organization or the support that they have because they may not have family members. I don't necessarily know if a Housing First model could deal with that, to be honest with you. So from my perspective, the Housing First models work well, but if they're not combined with a highly supportive services, then the project's never going to work.
Great. This next question reads, is most of SUM's work integrated, or was the Conway Center its first attempt at approaching housing, health, education together?
No, that's a good question. They always had this project. So they first got into the housing business back in 1989 by basically somebody giving them a 3-level walk-up that was in the heart of Adams Morgan in the district, and said to them, you know, we're going to bequeath this to you, do what you need to do with it. And they said, well, we need transitional housing. So it worked for them. And that's how it worked. But until Bill Conway got involved, you saw in one of the videos, he has a foundation called the Bedford Falls Foundation, which is named after it's a wonderful life in Bedford Falls, was the town that he was in. So he basically took them to the next level back in 2010 when they started their housing initiative, because they saw a need for that in the city. And they have basically 500 employees. Majority of them are in the social service work and the mental health areas and the medical side. Their real estate group is actually rather small. It's roughly less than 10 people. But right now they have 19 assets in the district. Started out with one in 1989, and they have roughly 800 units. This by far is their biggest project. Hope that answers your question.
Yeah, great. Thank you. All right, another question. If this project is located in the poorest ward of DC, does 30% AMI accurately ensure affordability for those that live there?
Yes, because the one of the stats in DC is the AMI in this area is 125,000 people, $125,000. So 30% of AMI gives somebody that's making $20, $30 an hour, 40 hours a week to basically be considered affordable. Uh, this part of DC is across the Anacostia River on the east side of the city, and ironically, it's now in one of the opportunity zones that's considered part of the new tax act that has been discussed for a while. So I think it will always be at 30% of AMI, and it'll be the most vulnerable people that need housing and supportive housing to get their act together.
Great. How is the center marketed to the immediate community? Do you use civic associations, libraries, or churches for marketing?
So some is well known in the District of Columbia. It has a lot of support from the mayor, the city council. It is a interfaith organization, so it has a lot of help from the local nonprofits that are affiliated with it. Surprisingly, when they started the process, they bought this land without the envision back in 2011, with the understanding that they were going to have to go through the local community. This part of the city it does have some issues. It's definitely the poorest ward of the area, but it's on a main street and it's close to the metro, and um, the support actually was pretty good because of the majority of the people living there. I think the latest stat that I saw was roughly, let me see here, bear with me 1 second. Yeah, like a 1 mile radius has 43,000 people, and the median income for that is $36,000. So you do the math on AMI of 120,000 in the greater Washington, D.C. area. It definitely meets that criteria.
Great. One last question, unless anybody is going to submit one last minute. What caused the increase in construction costs, and did that present any issues?
Oh yes. My HUD loan is probably going to be closing in 2 weeks, and 3 weeks from now it should have closed last year. Actually, it was planned to close in 2017. The construction cost went up dramatically from the time that was originally bid to the time that it was starting to do the construction. Bozzuto was the construction company involved with this deal. They're well known in the area and well known in around the Northeast and the Mid-Atlantic states. Down to Florida, they had a lot of issues with the construction because of labor. It has to comply with Davis-Bacon wages, and the Davis-Bacon wages, some of the vendors weren't paid, and that's why we're still delayed dealing with that stuff on the closing of the HUD loan for 40 years. The interesting thing about this project, which I did not talk about, is that it's actually stick over podium there. The first 3 floors are concrete, and it's underground parking for 180 some parking spaces. So we had environmental issues we had to deal with because it sat on an old gas station. And so the uniqueness of the project, the labor cost, and the fact that DC was booming in 2015, 2016, everywhere you looked in this town, and the people that live here know it, you see a crane because there's a height moratorium in DC for those that don't know the area. Nothing could be taller than the Capitol Dome except for buildings that were grandfathered. And I can see in the whole District of Columbia, there's probably less than 5 of them that that level or that height. So you had a lot of demand for construction resources, and it drove the labor. It also drove the material costs. You know, the concrete and stick, or the lumber and all the other supplies that were involved in this project. That's why when it was finally bid out, it was bid out at a guaranteed maximum price contract, and that obviously, when it was all said and done, whatever savings were in the GMC were, or GPC, I should say, were actually were given up back into the project. So it, I don't necessarily know if labor costs will continue to grow or to the point where construction costs become very difficult to deal with, but that was a challenge on this project because if you recall, we started this thing in 2011, 2012. We broke ground in 2015. So, you know, you were at the height of the market in terms of the amount of construction that was going on in this town at that time and the resources available.
Great. And we have a follow-up question to the question on marketing the center. The question is, how do area residents benefit from the training program? What percentage of graduates are from Ward 7 so far?
I don't have the number on how many people are from Ward 7, but I do know that since the CET opened in May of 2018, they've actually grown. They've had people coming in off the street by seeing this project and seeing the signs out front. They're doing it in a small measure as opposed to some of the other larger education facilities in the district. But I will say that they are unique. They specialize and they work with people that are mainly either don't have a GED or they don't have an associate's degree. So they are doing this as a beneficial, basically a holistic approach to get people self-sufficient and on their own, and providing them safe, secured housing with the job training that is needed. And it's actually grown to the point where CET's been around, I think, since the late like 2008, 2009. They only started it 10, 12 years ago, even though the organization will be 50 years in 2020. They've expanded that, and the jury's still out as to whether or not they continue to grow that, but they have the capacity to do 300 people in that facility, in that 21,000 square feet. And it's basically a year-long program. And it has worked. The woman that you saw there, Emily Price, who runs that organization on the CET side, is very hands-on, very organized, and it's to be around them and watching what they're doing. When I did tour the property with HUD back in the summer of 2018, when the project was delivered, we actually one of the rooms we walked into, you basically had a scale of a home. You know, you had the drywall. People were putting that up. You had the electrical. You had the plumbing. They were basically building a mini house inside this thing, and they rip it down and start all over again. So they're doing good things in what they do, and it's actually has had an impact. It's small right now. It's not something that everybody's talking about. And I will say that some is kind of shy and humble about things. They have a lot of support from the local business community, from the DC government. The U.S. Chamber of Commerce actually is a very large supporter of some, and if this thing could be a mimic around the country and some of the major cities which has problems with that, I think that will be a great thing for this for the legacy of some in the Conway Center.
Great. Well, that looks like all of our questions. So thank you to everyone who submitted. And of course, Frank, thank you so much for joining the Restoring Neighborhoods Task Force this month and discussing this incredible project. We're really excited about it, and we really appreciate the time you took today to talk with us and all the work that you did to make sure that this project came to fruition. Um,
And I would say for anybody that's on the phone or within your organizations, if you want a tour, reach out to Nathan or myself, and I can make that happen if you're in DC or coming to DC. They've had lots of tours. Matter of fact, we've when I was touring with HUD last summer, the day before, Senator Feinstein's office was in touring the property. And I know that last month, Stephen Mnuchin's chief of staff toured the property because they see this as something that is going to be as a benchmark for other organizations or other cities to do. And it is working from my standpoint.
yeah, and soon enough, the staff of National Housing Conference will come and tour too. So we're
Yeah,
definitely
you owe me a date.
yes, yeah. I will be getting that to you after this after the webinar. Fantastic. Well, for those who were on the phone and who heard me at the beginning say that we were going to have an update from our policy director, Tristan Barreau, unfortunately, he has gotten sucked into something else briefly. But just before we get off the phone, um, we do have our next Restoring Neighborhoods webinar scheduled for the month of April. And that webinar is going to be a presentation by Kevin Erman Sahlberg. He's the Digital and Geospatial Director of Mapping Prejudice out in Minneapolis, which works to map historical data using mapping software to illuminate the past policies in Minneapolis that have racially segregated cities and exacerbated racial disparities experienced today. So that is going to be coming up. If you were dying to hear Tristan give some updates, he will definitely be on that call, so you can tune in then. And other than that, thanks to everyone who tuned in today. We really appreciate the time. We hope you found the discussion interesting, and we look forward to talking to you all soon. Have a good one, everybody.